This program has been brought to you by blueskybio. We're not just compatible, we're better. We're a mountless design, easy to insert, with a blasted surface, a 1.8 millimeter collar, compatible with Straumann ITI implants, as well as LifeCore single-stage implants. blueskybio implants are easy to use, easy to insert. We're not just compatible, we're better. This is an external lift, and we're going to be doing an implant in the front as well. You can see from the bulge of the tissue that's approximately where the sinus is. We've made full thickness flaps at the mid crest, or just slightly lingual to the mid crest. I'm using a back action type of elevator to elevate the tissue, again because the incision tends to be more towards the palatal. And again, it's a full thickness flap. You'll notice the releases towards the canine. You want to have enough room to bring the osteotomy for the Colville-Luck mesial. This is a low-speed round diamond, approximately number 8 size, available from Salvin on a slow speed. And we're just removing a window. You can start to see the blue of the Schneiderian lining up here towards the occlusal. You want to create the osteotomy removal of the bone as close to the occlusal of the sinus extent as you can. It's easier to do the lift that way. A lot of irrigation. Again, bringing the lift up to where you think the mesial extent is. You can use a high speed for this if you want, and you have to be obviously very, very careful. In the beginning, you might want to use it on a low speed contra angle, only because you remove a little bit at a time. I generally do use a high speed, but I'm using the low speed here for demonstration. Again, in the beginning, you want to remove it a little bit at a time as you get some people call it a membrane, some people call it a lining exposed. Here's more of it exposed. What I'm doing is testing it to make sure that I've elevated released the window wall around, that it's flexible. Then, interestingly enough, this is the left side, which a lot of people perforate or tend to perforate because it's so difficult for access for righties. I'm using a periodontal curette, like a Gracie 1314 that I have dulled a little bit, just to get my elevation started and just to begin peeling the lining back a little bit away from the internal aspect of the bone. Again, starting to check it and elevate it towards the occlusal. Then I've taken an elevator from a set available from a company, and I've bent it in order to be able to again elevate the sinus towards the palate. I'm extending the elevation further, again elevating the sinus away. It's very, very important that the occlusal be completely elevated, and of course the medial wall has to be completely elevated and up. If you don't, you tend to get infections. That's what I'm doing right now with this straighter instrument. I'm going towards the medial aspect of the sinus, pushing the tissue back gently and elevating it completely up the medial wall. If I don't, since implants tend to be on an angle, then what will happen is they'll penetrate through an area that I have not grafted. Again, complete elevation towards the palate, away from the mesial wall, as the anterior wall as well. And now I use a glass syringe available from several manufacturers. I am inserting synthetic bone graft material. In this case, I like to use C graft material because it tends to be compressible. It tends to have some space between it, so you can get tissue growth, and it fills the sinus nicely. Peeling away the excess, I am now going to cover the area with a plaster lining. I could use this as my membrane on the wall. However, there's published statistics that if you use a membrane on your opening, you will get an increase of 5 to 8% of success on your implants. I am just using it here to compress it and get setting of the plaster membrane. Then I'm going to take a membrane as well and put it over the top. You can use any dissolvable membrane as well. Some are available from C-Graft. Now there is enough bone there to place one implant on the mesial. I am creating my osteotomy. I've started with a pilot drill that was a 2.8 millimeter standard drill for a blueskybio implant, which you can use either a life core drill or a Straumann drill. This is the 3.5 drill. Copious irrigation to the extent of where I want to carry it to. And then, of course, it's a blueskybio implants are mountless. You can put it on, shake it, it won't come off. And it's on a mountless drill in this case. And I can insert it with the drill at low speed. There we go. Insertion going into place. So on the distal eye of this area, I did a cololux sinus lift, and on the mesial there was enough room to place an implant. I'm doing it earlier now just to give the patient an extra tooth and a head start on finishing the case. Again, I'm placing, you can see a little bit better. I decided to place a little bit more plaster against the membrane, against the opening. I'm going to place a C-graft type membrane against it. The plaster will help hold it, and I will not have to tack it into place. This is the implant is a single stage. I'm going to do a little bit of flap contouring to get it to be supragingival when I'm finished, or at least the edge of the implant should be right at the gingival margin here. And so I'm doing some contouring to make sure we have a proper profile, and I'm completing suturing of the tissue the way you normally would with some Vicryl. Some people use chromic gut. There's the case completed clinically. There's the x-ray. You can see the lift on the distal and the implant on the mesial. When everything is all finished, there'll be 2 more implants going into the site in that area as well. And so this is